Hi, this is Doug and Cindy with Help Me Help Mama 5cast. Thanks for joining in today. And today we're going to follow up on our conversation last time. We were standing up last time, sitting down this time. But that's part 2 of our conversation on Geri Psych, or Geriatric Psychiatric Services. We had some questions last time, several questions and comments. Thank you so much for that. We appreciate it. We really do. So ask any questions or any other topics you want us to speak to. Please do that. But Geri Psych, where do we start with this? We're going to pick up where we left off last time. What's an example of a typical Geri Psych patient?
Okay, so we got 2 typical examples. One is an 80-year-old widow who's living at home, trying very hard to maintain her independence because she does not want to go to a nursing home. And the adult children checking in on her once in a while, and they start to notice, she's not bathing regularly. She's not doing her housekeeping like she used to. They look out at the car, there's a couple of new scratches or dings or dents on the car. She's just, it's like when I used to to recognize stuff like this, it was like a hairball in the back of my mind. Something's wrong here. Like the scratches and the dings, you can put your finger on it. But, why did she not take a bath? Did she take a bath and just put on dirty clothes? Is the same stuff in the refrigerator? Is she taking her medications? If she's not taking her medication, that's a sign.
And usually in this, where we go to the Geri Psych from home, it's more than just mom didn't fix her breakfast. It's more than that. It's something that usually they act out, they dump milk on their caregiver's head, they are just acting out somewhere or they go out and they get lost or out in the street. We saw a gentleman one time, they lived close to a busy street, and if you didn't watch him real close, he'd slip out of the house and be out walking in traffic on a busy street.
Or mom's living by herself and you check on her and you ask her, Mom, you taking your medication? Yes, I'm taking my medicines. And come to find out she's not. So she starts seeing things or hearing things, and she ends up in the ER. Okay, so.
And we saw one time that the daughter went in to check on dad, and she walked in the kitchen and he had a loaded pistol up on the microwave. Well, what's that doing there? That's never been there before. And things like this that are just, you can't really explain. Basically, you just know they need some help, and they need it now. So that's the first typical patient.
So you're looking for changes in behavior. Second typical patient for the Geri Psych is a nursing home resident. So think about it. Your loved one's been in the nursing home for a year now. Things have been rocking on just fine. And here recently, they hit one of the CNAs. Why'd they do that? The nursing home staff can't tell you why they did that. They can't diagnose it. So what they do is they will send the resident to the Geri Psych unit, and they will go through an assessment and evaluation and determine, are the medicines off? Was it why did this happen? And what they'll try to do is get them stabilized back to where they were before so they can return to that same nursing home. Now, we'll talk a little bit later about when they discharge and all that process. But the goal here is, if they come from a nursing home, go to the Geri Psych, get them stabilized, assess them, determine what's causing the behavior issues, and see if you can get it straightened out so they can return to the same level of care where they were at.
And sometimes there's been a change in their conditioning. Sometimes, we've seen it, something as simple, not really simple, but like a UTI or something like that can cause issues, and they just get some medical treatment, and then they're back where they were before. Sometimes it's just changing their medication. Sometimes they just got worse, and they're just worse. It can't be fixed. But that's the reason they're in there for usually a week or 2 or sometimes even 3, to give the staff there at the Geriatric Psychiatric Facility time to levelize their medications, or optimize, I guess would be a better word, their medications to where they can get the best results possible.
Okay, so if somebody's not in a nursing home, like the 80-year-old lady who is at home, and they go to the Geri Psych unit, they can usually be stabilized. And the Geri Psych can prescribe treatment that can help the patient to function better and they meet with the caregiver so that they can educate the caregiver a little bit about what to expect and how to deal with these behaviors. At best, if you can avoid the stimulus that provoked those behaviors. So it's an education process as well as treatment for the patient.
So one question a lot of people are going to have, how's this going to be paid for? I mean, this has got to be expensive, so how's it paid for?
Medicare,
Usually Medicare.
Medicare supplement, Medicaid, private pay, and there are also the Advantage plans. But if you have one of the Advantage plans, you really need to check first with your provider to make sure that this type of care is covered, and if so, for how long. Okay, so we missed a question. I want to back up and ask it. How to get your loved one into the Geri Psych treatment. Okay, so a family member can call the Geri Psych and refer your loved one to the Geri Psych facility.
Got my room.
Or if you're a senior, you can check yourself in. Go up there and say, I'm having issues, and you can check yourself in. You can also go to the emergency room and request an assessment at the Geri Psych. A fourth way is to get a referral from your primary care physician. So that's taking the extra step. Take Mama to her primary care physician and then ask them to make a referral to the Geri Psych.
Bottom line, this is a good service. If it's if it's needed, it's needed. If it's not, it's not. But it's where it's needed. It's really needed and really necessary. And we've personally seen situations where this made a tremendous difference in a senior's life, just to get their medications optimized where they weren't over medicated, but where they were receiving the right amount, right type, right dosage of the proper medication. So hope this information was useful to you. Thanks for your questions. Please send any questions or comments. We really appreciate that. We hope you have a great week.
Thank you for being a caregiver for your loved one. You're making a huge difference in their life.
If you like this video, give us a thumbs up. And if you want to see more videos like this, click on the subscribe button to subscribe to this channel, and click on that little notification bell to be notified the next time we do a video.
And if you want to interact with us, check out the description below and leave us a comment and let us know what legal or caregiver topics you'd like to hear about.